Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new or a regular viewer that has not yet subscribed, I would very much appreciate if you do. Not only are you going to be showing your support toward my content, but you also will be helping so many others find this invaluable and free content. If you haven't yet followed me on Instagram, link is below. Also go ahead and follow me on Instagram, especially if you do have Instagram. That's where I am daily to share with you tips, guidance, and additional information when it comes to gender dysphoria, gender transition, gender identity, all things related to gender. For today's video, I would like to discuss with you a spectrum of gender treatment, a spectrum of, gender treatment didn't really sound right, did it? A spectrum of possibilities to help alleviate gender dysphoria. And the reason why I want to talk about it as a form of spectrum is because I feel, and I found lately when I discuss it in this way with my individual clients, it helps people not only feel less terrified to take small steps, it also helps people have a better and a fuller understanding. And it also helps people to realize, to have awareness that there are options there for them, that going through full medical or surgical transition is not the only option. I especially like this idea of treatment spectrum. I need to find a better way to describe it. Treatment spectrum, because as you all know, a lot of times there is a myth that is being perpetuated not only by clinicians and providers, but also being perpetuated by trans communities itself, that unless you are going through the whole medical and surgical transition, not only are you not transgender, but you're also invalid or you're less than, whatever it is. There's also a myth that the only way to fully transition, again, is to go through all of that thing. And the only way to deal with gender dysphoria is to step into all of those things, which in my experience, I found it all to be deeply inaccurate. For starters, there is the decisions that people make in regards to which steps to take to alleviate distress they feel is not one and the same, or is not tied to trans identity. What I mean by that is transgender identity is transgender identity. You either identify as trans or you don't identify as trans. Your identity may also shift throughout your lifetime because guess what? You're a human person. For a lot of people, it changes. And it may not. It may maintain to be fixed and stable throughout your lifetime. So identifying as transgender has nothing necessarily directly to do with gender transition. Gender transition is a part of gender affirming care. It's a part of gender treatment that helps alleviate gender dysphoria, that helps treat gender dysphoria, the distress that a person feels. Of course, a lot of trans individuals feel distress and tearful step into gender transition or some elements of it. But it's not the same as you're not trans unless type of thing. The gender affirming care and treatment is not a treatment for transgender identity. It's a treatment for gender dysphoria. Very, very distinct, very different things. On top of that, somebody who has spent a long time focusing and working exclusively with adults who struggle with either gender crisis of trying to figure out what their gender is, or adults who struggle with any form of gender dysphoria, from very severe to moderate to almost neutral, non-existent. I have firsthand witnessed that what helps alleviate, decrease, or eliminate distress of gender dysphoria doesn't just only reside in going through full gender transition. And that's why it's so important to look at the options, the treatment available to help with gender dysphoria as a spectrum, because it is a spectrum. It's a spectrum. And in my opinion, a spectrum is very wide and very large. Now, when I say it's a spectrum, a lot of times people think, oh, it's a spectrum and it starts with social transition, right? No. In my experience, it starts first and foremost with acknowledging that you are struggling with gender dysphoria. Now, I know some people may think, how can acknowledging that you're struggling with gender dysphoria be considered to be a treatment for gender dysphoria? Well, I'll tell you how. Not acknowledging that you're struggling with gender dysphoria leads to increase in gender dysphoria because you're not dealing with it. You're either avoiding it, you either denying the fact that it exists, or you're running circles trying to justify to yourself that what you're experiencing is not gender dysphoria, that what you're experiencing is, I heard it all, middle-age crisis, that what you're experiencing is some kind of grandiose delusion, that what you experience is a phase that is going to pass until it doesn't pass. And so I've seen a lot of people struggle and have increased not only in dysphoria, but also in anxiety when they don't confront the reality. And yeah, it's absolutely is a treatment, because the minute a person confronts the reality is the minute that I've seen people also start feeling better. Now, does that make gender dysphoria completely go away? No, not in my experience. But it does help first reduce anxiety, because you're no longer running the circles in your head. And it does help also reduce dysphoria, because now you put a name on it. Now you know what you're dealing with. So the spectrum, in my opinion, starts with acknowledging that you have it. Now, acknowledge could be synonymous with accepting, but I feel like for a lot of people, acceptance comes somewhere later and mid down to the spectrum. But it starts with acknowledging. Then after acknowledging, keep in mind, there's no linear progression. So after acknowledgement, there's a variety of things that the individual can employ and do in order to decrease or alleviate the distress that they feel. It could be starting to see a gender therapist in your area, or just a therapist, or just start talking about this with anybody. That is also part of the treatment. That is also part of solutions that help decrease gender dysphoria. It could also be then to start explore that side, either through journaling, writing about it, or starting to dabble a little bit in the way you present, in the way you show up, in the way to maybe you relate to yourself and to others. It could be also tracing back your history to childhood and seeing what might come up. Part of the spectrum is also could be starting to feminize or masculinize, or starting to express yourself more publicly now. It could be coming out to people you love, coming out to people you care, and sharing with them that you are exploring your gender identity. It also could be any part of medical elements. Again, with medical, there's this misconception that it has to be this full regimen of hormones, and suddenly I'm opening the door, which I can't close. People have always done and always continue to start and stop hormones. Okay? It's not like you start and you just cannot stop. And there are microdosing options available. There's monotherapy available. There's so many options available today to consider, to think about. I've known people who stepped into some element of microdosing, and that was enough to quiet the noise of dysphoria, where they like, you know what? This is great. I did all what I needed, because I really don't want to go any further. And this is not causing me so much distress that I can't actively live and enjoy my life. Dysphoria is still there, Dr. Z, but it's not as prevalent and nagging. That is valid. Well, guess what? That person just found something that works for them, that is in alignment with their goals and their circumstances. Then after the hormones, there's other elements to consider. There are elements to consider of now whether you want to step further into other things in regards to transition. Are there any non-surgical things you want to consider? A lot of times we talk about surgeries as if surgeries are the only option, but there's a lot of other cosmetic non-surgical procedures. Even exercising and shifting your diet will modify how your body looks and feels to you, non-surgical. Even, for example, going and getting some kind of cosmetic procedures like fillers or Botox or something else, again, modifies how you feel and see yourself. Changing your appearance through clothing, hairstyles, makeup are all non-surgical interventions. So there's that option. There's also option going inwards on a spiritual quest of discovering what does feminine and masculine energetic attributes mean and apply to you, and how to show up daily in an attribute, in energetic shift that is more in alignment with who you are. There's also, of course, gender affirming surgeries. From facial feminization, masculization, to getting a more non-binary appearance of chest, you name it. Does it mean you have to go through all of them? No. And in my experience, for people especially who are very uncertain and very unsure, surgery should be the last resort, because you can do all of these other things I just mentioned. There's then also living your life and integrating and starting to accumulating experiences in your authentic gender. They're all part of treatment for gender dysphoria, because guess what? For some people, gender dysphoria continues even after feeling more aligned with how you see yourself internally and externally. And it continues for various reasons. It could continue because of different elements. It could continue because of the goals you have achieved or not. It's continue because the imposter syndrome is still there and it's very strong and it's pushing on you daily. It could also continue because you are struggling to integrate and assimilate and start living your life in your authentic self. It is a spectrum to look at. And for some people, part of the spectrum could be shifting where they are in regard to their gender to something that is more fluid and comfortable for them, that is not so rigid and this binary definition of their assigned gender that suffocates them. Why is looking at gender possibilities, gender treatment accessibility as a spectrum so helpful? Because for a lot of people who are so afraid to take the first step, one of the main primary reasons that so many are afraid to take first step is because their mind thinks that if I take the first step, that means I have to do all of the things. And all of the things oftentimes is medical and surgical. That's what tends to scare people the most. When did we stop talking about just looking currently, presently, what are little things we can do to help all of you alleviate the stress you feel right now? What are self-care coping things we can put in place to help you cope better? Guess what? Exercise, mindfulness, all of those things are also part of treatment. Grounding techniques help battle dissociation. Mindfulness helps you staying present. Exercise helps you decrease any anxiety you might feel and also increase healthy endorphins. Also part of gender affirming care treatment. But I feel like we're so socially inundated to only think about medical and surgical that for a lot of people who are not ready, it's naturally terrifying. My goal when I'm working with clients is how can I start moving you from staying at the very end, which is to me a sign of deep discomfort. So you're at the very end, you are deeply uncomfortable or uncomfortable or whatever degree dysphoria is. Remember, some people might have milder, some people might have neutral feel of dysphoria, but you want to do something about it. It bothers you enough where you want to take some steps. How can we start considering what's in these early stages of gender treatment spectrum? How can we start introducing them into your life and help you get to the point where dysphoria is quieting down enough, where you are starting to see your whole situation even more clearly? And from that space of clarity, you can start making decisions about bigger things and whether they're even warranted. I always say, and I always will continue to say, gender transition is not for everybody. For some people, it's not realistic, it's not feasible. For some people, it's just not worth it. I had worked with so many people with whom we figured out way to alleviate distress where they can continue with their life without going through medical, surgical, because for them, it was just not worth it. That's personal choice. That's a very personal choice. And so this idea that transition is the only way is not true. It is not. There's so many other things in between. So I want all of you who are over here who haven't taken first steps to consider that there are little micro steps you can take that can help you feel less distress. Most importantly, quiet down the noise of dysphoria so you can start thinking clearly. So you can start seeing your situation clearly. Because the truth is, sitting over here on a fence and not doing anything about it is also not helping you. All it does is continue to spin you and make you feel more and more out of control. And as I said in one of my other videos, when you are there, your tolerance, you think you can tolerate because you feel like your tolerance is increasing, but what you're doing is also you are accumulating. You building up the pressure of dysphoric distress that eventually either going to blow up, and that's when gender crisis happens, or it's just going to make it so intolerable that then you're going to jump to make decisions that are too early for you, too soon. You're not ready yet. You need time. You need time to adjust, to digest things. I've seen that happen too. So I want you all to start thinking about the treatment for dysphoria as this big spectrum of so many things embedded in it. And that you don't have to go through all of them, first and foremost, to be trans. And you don't have to go through all of them to feel better. You can, of course, if you want to. You also don't have to. So start thinking about it as a spectrum. Comment below, share where you're at, share what you're doing to alleviate your distress and what is being very helpful to you right now in your life. Comment, and I'll see you all next time. Goodbye.